my name is Erin Montgomery, and I'm going to show you how to do a sterile dressing change in a wound culture. So first, I'm going to bare home order, follow my general principles and safety practices, follow my 11 rights of medication administration, and my 3 checks if medication is ordered. I'm going to assess my patient using 2 patient identifiers and allergies, and then I'm going to assess their pain levels, and if it's above a certain level based on the order, I would give pain meds. So first, I'm going to gather my equipment, which I already have it. I'm going to explain the procedure, provide privacy after I did my hand hygiene, identify the patient again and myself, identify them using 2 patient identifiers and for allergies. So I have my gloves on, and I am going to remove the dressing using the push-pull method. If it's not coming off, I could use adhesive remover. And then using my taco, I am going to assess for texture, type, amount, color, and odor. There is no discharge though. The patient has sutures, not staples. There's no signs of infection, and there is no drains or tubing. So now I'm going to take off my gloves, perform hand hygiene, and wipe down my area for my sterile field. And now I'm going to open up my package, going over, but not over the sterile field. I'm going to use the 1-inch border to pick up my sterile field. Not going over my sterile package. And not letting that go over the edge. I already put that there. I have not went over my sterile field. So now I'll put on sterile gloves, which I can't do right now because of my arm. I will do that at a later date. And I'm going to go ahead and get all my stuff out of my container onto my sterile field. I checked. This container has not been expired. It is still usable. Like I said, I have my sterile gloves on. Now I'm going to clean the wound, starting from the least contaminated to the most. Keeping my hands above my waist. Pat dry. This wound has not been ordered packed, so I can just put my dressing on top. But first, I'm going to do my wound culture. This came in my sterile pack, so technically the outside is sterile. I'm going to twist firmly inside the wound, or on the most contaminated part. I would make sure to label this with my initials, the date and time, and where it was collected from. And now I'm going to get my dressing. So now that that is on, I don't have to be sterile anymore. As I said, I would put on my sterile gloves, but I cannot. So I would tape down the edges. Just like that on the edges. Do that around all 4 edges, but I cannot tear the tape right now. So after that was taped down, I didn't have to be sterile anymore after I put this on, so I could touch whatever tape I needed to. I am going to take off my gloves, hand hygiene. I've already initialed this and put the label on it. Send that to the lab after I labeled outside of the bag as well. I would get a piece of tape, put it on my dressing, and I would initial it as well, label it with whatever the hospital required, date, time, initials, where it came from, all that good stuff. As I said, it did not need to be packed, it was not required. Excuse me. I've already taken off my gloves, hand hygiene. I would clean up all my area. I would reassess the patient's pain level to see if they were in any more pain, any less, and then, as I said before, if pain medicine were required, I would administer it as ordered. The patient tolerated the procedure well. The wound does not seem infected. Like I said, I would send that off to the lab, record and report hand hygiene, and then come back and reassess.